that point.
Yeah.
Yes.
Yeah.
Yes.
Yeah. No problem. No problems. So, and this is at what pressure?
It's at
This is
600 kilopascal.
600.
Six. Just a moment. Mhm. I think it's 600 Pascal.
Yeah, 600 pascals. Exactly. Perfect. So, can you tell me what is the triple point of water, thermodynamic triple point of water?
It's a state where water exists simultaneously. Water exists in solid, liquid, and gas at the same time.
Yes, it exists as ice, water, and water vapor in all the three phases. Yes,
All the
that's
three.
correct. Correct. And what is the relationship between Kelvin and Celsius?
0 degrees Celsius is equal to 273.15 degrees Kelvin.
Perfect. So if you have to convert Kelvin to Celsius, how would you do that?
273.15 plus degrees Celsius.
Yes, perfect. Perfect. Okay. Now coming to some physiology.
Mhm.
So can you define what is normothermia?
Mm. Normothermia is when the body is at the accepted normal temperature of 37 degrees centigrade.
Can you give a range, sir?
Range as 35 to 37.
No, sir. Here you have to be very accurate. I'll just tell you. You just please note down, because this is a question that is very commonly asked in Vivas, regardless of what question you have. In every major case, they expect you to talk about temperature management, monitoring and management. So please note down, normothermia is core body temperature of 36.5 to 37.1 degrees. And
36.5 to
yeah, this is core
37.1.
body temperature.
Core body temperature.
And peripheral temperature is of a wider range, that is 36 degrees to 28 degrees centigrade. But when you're defining normothermia, you have to define as core body temperature only. That is 36.5 to 37.1. This you should not forget. This value 36.5 to 37.1, you should not forget. And this normothermia, to what range is it maintained in the body?
I'm not sure to what ranges it maintained.
Yeah.
I have read about the hypothermia during intraoperatively.
Okay, no problem, sir. It should be kept within 0.2 degrees on either side for
0.
optimal conditions for enzyme reactions. So the body tries to keep it 0.2 degrees above and below this range of 36.5 to 37.1 degrees centigrade. Yeah. So this you should not forget. This is a very important value. So generally, any main question of long surgeries, do not forget to mention that you will be measuring temperature and you will be maintaining temperature to avoid the effects of hypothermia. So about which we'll talk a few minutes later. So you have a uh, core and a periphery. So what is the function of this peripheral compartment?
It acts as an insulator.
It
It
acts
provides a
as
temperature gradient between the periphery and the core.
yes. It allows it functions as a
Temperature
heat
gradient.
sink. It either absorbs or releases thermal energy to maintain the core. So like I mentioned, the temperature in the peripheral compartment is maintained within a range of 36 degrees to 28 degrees. Okay. So can you tell me what are the normal variations in temperature?
Normal variations.
Yeah. when do you think is it the lowest in the body, and when do you think it should be the maximum?
Yes, sir. Temperature,
No problem, sir. It is
I
generally
think
lowest
it's
when you are waking up,
it
before waking up.
yeah, there's a dip in the early morning hours.
Yes, before waking up,
Yeah.
it is the lowest, and maximum in the
Then
evening.
during the day,
Yeah.
it goes
Yeah, during the evening it is maximum. So there is a variation of about 0.7 degrees. And another physiological state where temperature is increased is the menstrual cycle. It goes about 1 degrees higher.
and at ovulation there's a dip.
Pardon me, sir?
During ovulation there's a dip in the temperature.
Yes. So, sir, can you tell me how is temperature transmitted from the periphery to the center of the brain? Just like pain,
Mhm.
it is
It's
transmitted from, suppose
the
you touch
blood.
some hot object or a cold object. So
Mhm.
from there, similar to, the pain pathways from where if you touch a pin or something,
Okay,
when
temperature
pain is
sensation.
yeah. So how is the temperature sensation transmitted from the periphery to the brain?
I'm sorry, I'm not able to recall. I read it, but
No
at the
problem, sir.
moment,
No problem.
that
No problem.
I think is the A delta fiber.
Yes. Correct,
A
sir.
delta fiber which carries, and the
Mhm.
thermoreceptors in the skin.
Yes. These thermoreceptors, do you know the different types, sir? Can you recall?
No, sir, sorry, cannot recall.
Okay. There are unimodal and polymodal. Unimodal and polymodal receptors, which detect this cold and warm temperature. And then, sir, this you're right. A delta, and what are the other fibers that transmit these?
See,
Yes, very good, sir. Can you be more specific? Which one is for cold
yes,
and
sir.
which one is for warm? If you have any idea.
I think A delta is for warm
Okay.
and C is for cold.
Yeah, it's just the opposite. A delta is for
Opposite,
cold
yeah.
and C is for warm.
C is for warm.
Yeah, and from there,
I'm not able to recall the pathway.
okay, no problem. From there, it goes to the lateral spinothalamic tract, and then it goes to the hypothalamus, where information is integrated in the preoptic nuclei of anterior hypothalamus. And what are the other receptors, sir? Do you have any idea? These are the peripheral. Do you know of any central tissue receptors?
I'm not aware of that.
Yeah, there are visceral and there are visceral receptors, which are thoracic and abdominal viscera, and there are some deep tissue receptors in the spinal cord itself.
Okay.
Yeah, so all this information is integrated in the hypothalamus, and the temperature set point is determined by posterior hypothalamus, which gives out the efferent responses. And it can you do you have any idea about the efferent responses? What are the efferent responses?
Efferent response.
Have you heard about the warm threshold and cold threshold?
Yes, I've heard about it. Once the set point of warm threshold is exceeded or reached,
Yes. Mm-hmm.
then the hypothalamus puts the alters the physiology into a heat losing mode. It increases sweating and causes cutaneous vasodilatation.
Yes,
Promote
we'll
heat loss.
elaborate on that. So basically, there are two responses. Once the warm threshold is exceeded, there is a heat loss response, and once there is cold threshold exceeded, there is a
Heat
thermogenic
conservation response.
Yes, thermogenic activities are initiated and heat is conserved. So, what are the warm threshold responses, sir? Like you are already saying.
cutaneous vasodilation, sweating.
Yes, correct. In an awake patient, sir, in an awake patient, what else can be done?
If in an awake patient,
Dr. Sangeeta, can you mute yourself, please?
patient can consume water.
Pardon me, sir?
Patient can move to
Any other behavioral?
yes, sir, would move to a colder place.
Removal of clothes.
Removal of clothes.
Yes.
Removal
Yes.
of clothes.
Yes. Yeah. So there is cutaneous water vasodilation. So how does it work, sir?
By raising temperature of the skin, it facilitates heat loss through radiation.
Yes.
And
yes.
because of sweating, when the sweat evaporates, it
Yes.
causes heat loss through evaporation.
Yes, correct. Yes. And what about the hairs?
Hair, yeah, erector, hair.
Just like in cold, there is piloerection. Here, the hair lie flat so that there is increased airflow.
Hair.
Yeah.
They don't impede the flow.
Yes, they don't impede the.
But somehow
no problem, sir. No problem. Yeah, no problem at all. No problem. Yeah. So if suppose the cold threshold is exceeded, then what are the measures?
And peripheral vasoconstriction.
Sir, again, you can start with the behavioral.
Okay, behavior.
Yeah.
So if the cold threshold is exceeded, then the patient moves to warmer areas, covers himself with more clothing.
Correct.
There's contraction of the erector pylori muscle, which allows hair to stand straight and impede the flow of air up against the skin. Blood flow to the skin is decreased, and thermogenesis is started by increasing metabolism. In case all these measures fail, then and temperature still drops, then shivering begins in an attempt to increase body temperature.
Yes. So what does shivering do? It increases
shivering. So there's a first law of thermodynamics that it's impossible to take heat from a source and convert all of it into work done without rejecting some of the steam. The same principle applies here. When the muscles contract repeatedly, the total energy consumed, part of it is converted to mechanical action and rest is converted to heat. This heat is used to raise body temperature.
Okay. So it can increase the BMR up to 600% shivering. 600%. Yeah. And do you know any other measures of thermogenesis apart from shivering? Especially in
neonates, especially brown fat
yeah.
utilization.
How is it? How is brown fat different from other fat?
Brown fat is metabolically more active, and
the reason for it? The reason for it being?
Sorry.
A large number of mitochondria. There's a large number of mitochondria, so that increases metabolism, and that is called chemical thermogenesis. And the heat production increases by almost 100%.
Without shivering. No.
Yeah. So these are the measures when the thresholds are exceeded. Can you elaborate the causes of hyperpyrexia?
Hyperpyrexia can be
starting from the most simplest that we see usually.
Infective conditions.
Yes. What happens, sir? What is that? What happens?
When there's an infection, pyrogens are released.
Yes. So what does it cause? It causes fever.
Fever.
Yeah. So that is one condition. That is because of production of pyrogens like interleukins, interferons. They release prostaglandins in the hypothalamus, and that is how your antipyretics act. They reduce the release of prostaglandins by inhibition of Which enzyme?
Cyclocox.
Excellent.
Cyclooxygenase.
Perfect. So, any other conditions you know, sir, of hyperpyrexia?
Yes, sir. Neurogenic.
Okay, correct. Yes. Then
hyperthyroid.
Especially which area of brain there is a stroke you find hyperpyrexia?
I believe it should be involving hypothalamus.
Yeah, it's actually pons. So if there is a stroke in the area of pons, there is hyperpyrexia. Any other conditions?
Thyrotoxicosis.
Okay. Then one that is very relevant to
poisoning.
us. Very relevant to us as anesthetists. Any other condition which can cause?
Atropine administration.
No, something that can be fatal.
Malignant hyperpyrexia. Malignant hyperpyrexia.
Yes, correct. So what exactly is the problem in malignant hyperpyrexia? What is the pathology?
Yes, sir. There are some sensitive individuals.
Where is the basic defect, sir? If you have to answer in one line.
RYR receptor.
Yes, ryanodine receptors.
Ryanodine receptors, they are abnormal and they
cause excessive calcium release and then
excessive calcium release, which gives rise to very strong and continuous muscle contraction. Which,
correct. So it's like a calcium storm that's released. And
yes, sir.
Yeah, correct. Perfect, sir. Any drug you said atropine. Anything else? This is usually a question that is asked in EDAIC. In one other drug which causes hyperpyrexia and has to be treated in similar lines as malignant hyperpyrexia. Any drug you know, sir?
Drug.
Any recreational drug?
Neuroleptin syndrome. Ecstasy.
Yes, it is ecstasy. Yeah, ecstasy or MDMA, it can cause hyperpyrexia. Okay. Yes, let's go to causes of hypothermia. How do you define hypothermia, sir?
Temperature below 35 degrees centigrade is hypothermia.
It's actually 36. It's actually 36 degrees. And you should be specific. It's the fall less than 36 degrees in core temperature. You have to be specific about 36 degrees core temperature.
Actually, I was reading in that blanket.
Okay.
They have shown a graph.
Okay.
Fall in temperature under GA. The first hour they say is 37.
Yeah, that is different, sir. I'll come to that. That is different. But if you have to define hypothermia, you have to specifically tell fall in core temperature to less than 36 degrees. You should not forget this. They will generally ask you. In exams, they will ask you. If there's a major case and you have to, when you're talking about temperature management, they can ask you this. So these numbers you should not forget. So what are the causes of hypothermia? Can you elaborate a few causes?
Exposure to cold.
Yes, very good, sir. Next.
Hypothyroidism.
Yes, excellent.
Under anesthesia, under general anesthesia.
Yeah. Yes. Prolonged surgeries. Yes.
Yes, sir.
Correct. And another, some other causes, sir? Any age group that is very prone to hypothermia?
Yes, sir. Extremes of age.
Yes, extremes of age.
Or old people.
Correct. Yes, excellent. Any other condition which can cause hypothermia? Drowning, near drowning. That can also cause severe hypothermia. Okay. Yes. Since you are the only volunteer, I will ask you all the questions, sir. Is it okay?
Yes, it's okay.
Yes. Yeah. What are the consequences of hypothermia?
With the onset of hypothermia, metabolism goes down.
Yes.
Enzyme activity goes down.
Yes. Perfect. Yes.
There may be coagulation failure.
Can you go system wise, sir? Here you have to go system wise.
Okay.
Yeah, start.
First of all,
sir, whenever you have to, one technique you can use, start from head to toe. Head to toe in the sense, start from CNS, then CVS, then RS, then other systems. So that then you will not miss anything. So you can start.
maybe,
Start from CNS. You can start from CNS.
Yes, mental slowness, confusion, irrational behavior.
Yes. When does it start, sir? Below what temperature does it start? This cognitive
Below
impairment?
28.
No, sir. It starts much earlier. Below 35 itself, it will start. Cognitive impairment will start. And at what temperature can there be loss of consciousness, sir? Any idea?
Sorry, no idea.
Less than 30 degrees, there can be loss of consciousness. This all I'm talking in terms of core temperature only.
Core, yes.
Yeah. Yeah.
Below 30.
Yeah.
And
so coming to CVS,
there would be decrease in stroke volume, bradycardia, hypotension.
Yes, and all these are because of what, sir? Once there is hypothermia, there is decreased myocardial contractility, and then thereon it causes all these effects. It causes
ionic movements get slowed, and then they result in.
Correct. Regarding myocardial oxygen uptake, is it reduced or is it elevated in hypothermia?
It's reduced.
Yes, correct. And then talking about the ECG, any changes in ECG, sir?
In bradycardia, of course.
Yes, then. Anything specific, sir, in ECG with regards to hypothermia? Can you
Osborne wave, J wave, Osborne.
Yes, the J waves. Okay. Yes, correct. And when do you think at what temperature can arrhythmias occur? Less than 32 degrees onwards, you can have all sorts of arrhythmias. And less than 28 degrees, you can cause VF. And this VF cannot be reversed unless the heart is rewound. Okay. So when there is this hypothermia induced cardiovascular effects, when you use volatiles, it will accentuate the effects of these cardiovascular effects. Okay. Respiratory system. Anything, sir, you can mention?
Respiratory rate and cardiac volume go down. Minute volume goes down.
Yes, correct. Can you mention specifically anything, sir, with respiratory system? ODC, do you think it should go to the right or it should go to the left? Oxygen
it will go to the left, sir.
Yes. We have to mention this, sir. This is important. Okay. When it comes to respiratory system, you have to mention this. And any idea what temperature apnea occurs? What core temperature? Around 24 degrees. Yes. What are the other systemic changes? Can you recollect any hematological effects of hypothermia?
Yes, coagulation failure.
Okay. Why is that, sir? Why does it happen?
Because of low temperature.
What happens?
All enzymatic activities go down.
Yes, perfect. Yes. What else, sir? Hematological? Any other?
There may be stagnation of blood flow to the vessels.
Yeah.
That causes thrombosis.
Yeah. Why does this stagnation occur?
Because of peripheral vasoconstriction. Decreased
yes, that is number one. Yes. Number two, sir. Any other physical
viscosity goes up. Viscosity goes up.
Excellent. So for every 1 degree fall in temperature, the viscosity goes up by 4 to 6%. Okay, if possible, you can remember this.
So sorry to interrupt, sir. Shall we mention here, while mentioning the changes in the RS and CVSR, like a hypothermia sets in, initially there will be a compensatory mechanism try to regenerate that, and so there will be increase in the peripheral vasoconstriction, increase in the respiratory activity, oxygen consumption, and then as the temperature goes down and down, then the compensatory mechanism becomes sluggish, and then there will be a myocardial depression, and then arrhythmias, or in a RS there will be a gradually shallow breathing and decrease in tidal volume and minute volume.
Yes, you can mention that. Yes, and the specific temperatures you can remember when there is apnea, when there is VF, you can mention all this. Okay. May know who's this?
32 degree, 30 degree, 20 degree. Sir, I'm Dr. Hitendra Mahajan from Nasik, sir.
Hello, sir. How are you, sir?
Hello, sir. I'm all fine. Thank you, sir.
Yeah. All right, sir. Yes, you can mention this, sir. Yeah, I just told you some temperatures where you have these critical effects. You can just remember that, and you can mention that once all these compensatory mechanisms.
32 degree, 30 degree, 28 degree.
Yes, sir. Yes. You can mention, sir. You can mention that. Yeah. So, any other systems, sir, Dr. Narendra? Any other systems you can recollect?
Yes, sir. Musculoskeletal system.
Yes, sir.
Muscle contraction becomes sluggish, and relaxation also becomes sluggish.
Yes.
Contraction takes place slowly, but then the muscles do not get back to their normal resting positions also in a good time.
Okay. Renal system, anything?
Specifically, I don't know, but I can just guess that.
Yeah. No problem, sir. Take a guess. No problem. This is not an exam. You can take a guess.
There would be some deterioration of renal function also, especially
decreased renal blood flow, and there can be oliguria because of decreased renal blood flow.
Renal vasoconstriction, there's a decrease of GFR, and
yes,
there's a decrease of urine output, and that's the oliguria.
Yes, very good. Okay. What are the metabolic effects?
Since metabolism would be slow, there would be
decreased BMR.
Decreased BMR.
Yeah. Can you guess what percentage it decreases by every degree? Around 8 to 10% fall in BMR for every degree fall in temperature. And because of shivering, any idea how much is the increase in oxygen intake? Oxygen consumption?
I think up to 300%.
Up to 800% oxygen consumption can increase.
Consumption, maybe.
Yes. And there can be hyperglycemia, increased circulating catecholamines. And potassium, any idea, sir? What happens to potassium?
No idea, sir.
Yeah, there is an intracellular shift, and it can cause hypokalemia, which again perpetuates the effect of.
What's the mechanism of this change?
The hypothermia causes intracellular shift of potassium, and hyperthermia causes extracellular shift. It's a physical property.
Okay.
Hello?
Yes, sir. Right.
Hello?
Hello?
Yeah.
Yes, I'm here.
Yeah. So coming to the next question, sir, can you elaborate the mechanisms of intraoperative heat loss?
Yes, sir.
Yeah.
The most important mechanism is radiation.
Okay.
Which accounts for 40 to 60% of the heat loss.
Okay.
The next important is convection.
Yes.
Which may result in 20 to 30% of heat loss.
Can you describe this radiation a little more, sir?
Yes, sir. Radiation is the loss of heat from one object to another, depending on the difference in their temperatures.
Yes.
Without the bodies being in physical contact with each other.
Yes, that's very important. Yes. Okay. Next, convection, sir.
Convection is when.
How does it Can you elaborate?
Yes, sir. It happens when cold air comes in contact with the body, gets warm,
Yes.
and then moves away and is replaced by
Another layer
more
of cold air.
air.
Yes.
Cold
Yes.
air, which again takes heat and moves away.
Yes. Fantastic.
The conduction is transfer of heat from one body to another when they are in contact with each other.
Yes. Yes. And what percentage would that be?
That would be 5 to 10%.
5 to 10%. Okay. Evaporation, sir?
Evaporation is when water evaporates,
Mm-hmm.
it takes away heat of vaporization with it.
Okay. What heat? What type of heat is that, sir?
It's a latent heat.
Yes. Excellent. Yeah. Okay.
Which is quite high in magnitude. I think it's a 3,340 kilojoules per kg. And
Okay.
other part is warming of the inspired gases.
Okay.
So if the gases inspired are dry and cold, then heat would be lost on two accounts: for warming the air and for humidifying the air.
Yes. Excellent. Excellent. Yeah. So for each mechanism of heat loss, can you suggest remedies which we can? Yeah. For radiation. Let's start with radiation.
Radiation can be prevented by decreasing the temperature gradient between the patient and the surroundings.
Excellent.
It can be done either by pre-warming the operating room or through forced warm air.
Fantastic. Okay. Yes.
The convection can be decreased by putting barriers between the patient and the air.
Yes. Fabulous.
Through blankets, sheets, reflective foil.
Yes.
Conduction
Excellent.
is not very important, especially because usually operation tables, they have a layer of non-conducting material.
Yes. Correct.
Specific steps to increase heat loss through conduction are probably not warranted.
Not important. Correct. Next.
The last part can be corrected by using mechanisms to humidify and warm the air.
Fantastic.
We can use a cold water bath, which can raise the humidity by 10.
Yes.
Humid HMEs can increase the level by 25.
Okay.
And hot water bath can increase up to 50. Nebulizers can increase up to 60, and ultrasonic nebulizers up to
100%.
90.
Yeah.
However,
that is not recommended.
If we are using devices which are, since absolute humidity of water at body temperature is 44 grams per cubic meter, any device which increases the humidity level above that can cause overload, systemic overload.
Yes. Fantastic.
Pulmonary edema.
Superb. Excellent. And evaporation, is there much you can do, sir? If there is a major surgery or laparotomy, can you do much about it? There is not much you can do about it.
Not much can be done about it.
Not much can be done about it. Yes, that you can mention. Yes. So
you can try covering the bowels with the wet cloth whenever it's
possible. In between surgery. Yes.
Possible. Yeah, in between the surgery.
Correct.
And of course, respiration, sir has already told about the humidification.
Yes.
These are the two main, especially in neonates and all, it matters more. Pediatric surgery where laparotomy bowels are exposed, and so you should try to prevent as much as possible the evaporation loss of heat.
Yes.
And you can mention it is heat loss in under anesthesia is under three phases. Initially, it is the redistribution which causes the loss of heat. Then the linear fall, which is because of radiation evaporation.
That I will come to. That is the next question, sir. I'll come to that. Yeah. Before that,
yes, sir. Yes.
Before that, Dr. Narendra, why do you think there is more heat loss during surgeries?
So the
surgeries under anesthesia.
Thermoregulatory mechanisms are suppressed.
Yes. Any particular
this,
one is
yes,
completely abolished? The behavioral one is abolished, isn't it? Once under anesthesia,
behavior
patient
is
is not able.
abolished.
Yeah, that is
Behavior
completely
is
abolished.
abolished.
Yes. Then what are the other two important things?
Peripheral vasoconstriction.
If you give volatiles, is there vasoconstriction or?
Yeah, it will cause. I said peripheral vasoconstriction is also lost.
Lost. Yes. Excellent. Excellent. Anything else? Any other important mechanism? Decreased muscle
relaxation takes
yes.
place.
Yes. Decreased muscle.
So the heat generation also goes down.
Yes. Excellent. Excellent. Let's talk about phases of blood loss. Dr. Hitendra sir was mentioning already.
Yes, sir.
Can you elaborate the 3 phases, sir? And
Yes,
can
sir.
you just draw a diagram? You are practicing with a whiteboard, or you can switch on your camera and then write on a piece of paper and show me.
I can draw on the whiteboard.
Yeah. If it's convenient, whatever is convenient.
Yes, sir. It's convenient.
Yeah. If you have a piece of paper or pen, that will also be fine.
Yes, sir.
Yeah. So what's on the x-axis and y-axis? Can you tell me?
X-axis is
time. Yes.
Time. And here is temperature.
A general tip when you're drawing all the diagrams, this for everyone, just remember what's in the x-axis and y-axis. Sometimes it can get confusing. Not particularly about this, but most of the diagrams you have to practice the particular units and what's there on x-axis and y-axis. Never forget that. Because if you don't mention that, the diagram becomes incomplete.
I don't know how it has moved.
Okay.
Maybe somebody moved accidentally. Somebody has moved my diagram.
Okay, never mind, sir. Can you tell me in words?
I'll draw again, sir.
Yeah.
Please, nobody should click here. Otherwise, it will be lost. Amp and time. 37.
Yes.
35. 34.
Yes, perfect. Excellent.
So first star.
That is 37, that is 5.5 and 34. 3 numbers you have to remember here. 35.5.
This is first
Excellent.
star.
Yes.
Second R and then
Yes.
plateau.
Yeah. So can you explain why these phases happen?
Yes, sir.
Yes, sir. Please.
In the first star, because the peripheral to pore gradient is lost, temperature dips by around 1.5 degrees centigrade in the first star.
Yes. Okay.
Then the rate of fall decreases.
Yeah, correct.
And it over the next 1 hour, it goes down by another 2 to 2.5 degrees.
Yes, correct.
At the beginning of the third hour, compensatory mechanisms become active, number one.
Yeah.
Secondly, the temperature gradient between the body and the surrounding also goes low. So the rate of heat loss goes down even otherwise.
Yeah. So in the second phase,
plateau phase.
Yes.
Second phase is the one where we can interfere the most.
Yes. So that is where you have all this radiation, evaporation, conduction, convection, etc.
Yes,
so if you pre-warm the patient and if you have warming mechanism during surgery, you can draw a line where you avoid the downfall in the phase 2.
Yes.
Yes.
Okay. There's another point, maybe if I don't know whether it will be relevant.
Yeah.
The basic law for the cooling is the rate of cooling is proportional to T raised to 4 minus T naught raised to 4, where T naught is the surrounding temperature and T is the object temperature.
I am not aware of this, sir. Yeah.
Is it
given in some books, sir?
Okay. This is Stephen's law of cooling.
Okay.
But for
Maybe
everyday
it-
use, we use a simplified form, Newton's law of cooling, which states T is proportional to T minus T naught. So
Okay.
because it's an exponential change, so whenever the temperature falls, theoretically it never touches the sink temperature.
Okay.
And as it gets closer to the surrounding temperature, the rate of fall also becomes very low.
All right.
This factor
Okay.
also operates in this third hour.
Okay. All right. Okay. All right. So next, how would you manage severe hypothermia?
Forced air.
Sir, any
warm
critical
fluids.
condition, this is an advice. Start with ABC. You just tell number one, I'll start ABC, and number two, I'll call for help. These two things you have to mention. Any critical thing is asked, always do not forget this. Just if you tell these two things, you have a start for your answer. Always, never forget, never go directly to the, suppose I ask you about malignant hyperthermia. Do not go directly to Dantrol. You have to start with the basics. So in severe hypothermia, just say that I will start the basic management of airway, breathing and circulation. And then, and then you continue with the other things you have to say.
Yes.
Call for help and ABC. Never forget. Any critical incident, these two things you have to remember.
ABC and call for help.
Yes.
Then start forced air, warming of the patient, give warm fluids.
Yes.
May ensure that patient
again you can
breathes
classify.
humidified.
Again you can classify here.
We can
a hypothermia of gradual onset and hypothermia of rapid onset. Okay, if there is a hypothermia of gradual onset, you have to do the rewarming slowly by about 1 degree centigrade per hour. Okay, and if there is rapid onset hypothermia, you can do rapid rewarming. And again, rewarming you can classify as external and internal. Correct? External, you can use forced air blankets and radiant heaters. And internal, what are the measures there? You were speaking about
warm fluids, warm humidified air for breathing.
Yes.
If patient has a Foley's catheter, maybe we can irrigate using warm saline.
Yes.
If the surgeon is operating, we can ask the surgeon to use warm saline mops.
Yes.
Covering the open cavities.
Okay. Yes, correct, sir. Excellent. Fantastic. Now we go to the last part of today's class, or I must say assisted discussion. What are the measures, what are the methods which can be used to measure temperature that you know of?
Yes, sir.
Can you
temperature
list it
measurement?
out? Yeah.
Yes, sir. Can be non-electrical or electrical.
Yes.
Non-electrical, we can have mercury thermometer.
Okay.
We can have alcohol thermometer.
Sir, you can just go with the 4 types, sir. First, then you can elaborate on each. Like this mercury and alcohol, it is which type, sir? Non-electrical?
Non-electrical.
Yeah, in non-electrical, this mercury and alcohol are anything you know of, sir? What are they called? They are liquid expansion thermometers.
Liquid.
So in non-electrical, you have liquid expansion, gas expansion, bimetallic strip, and chemical thermometer. Correct?
Yes, sir.
Can you now elaborate, sir? Liquid expansion, you have 2 types, right? So what are the 2 types?
Liquid expansion, I know mercury and alcohol thermometer. Mainly mercury is used more often in clinical practice.
Okay.
There's a bulb, mercury bulb.
Yes.
It's a glass tube.
Correct.
With vacuum, with a central core, which is vacuumed. At the lower end, there's a glass bulb which contains mercury. When this bulb is placed in contact with the part of the body where we want to measure temperature, on exposure to temperature, mercury expands. It moves up the capillary inside the device. There's a narrow portion at the neck. Mercury goes up, and then it cannot come down on its own.
Yes.
After reading the temperature, we have to shake the device so that mercury goes back into the bulb.
Perfect. Excellent. So what are the advantages and disadvantages?
Is small size,
Yes.
cheap,
Yes.
accurate.
Correct. And what are the disadvantages?
Disadvantage, mercury is a polluting agent.
Correct.
When these thermometers break, mercury is spilled on the soil.
Yes.
Which poisons the soil. In fact, many places it has been banned.
Yes, correct. Okay. Next, gas expansion thermometers.
I'm not aware of that.
Okay. It's a Bourdon gauge dial thermometer. So basically, there is volumetric expansion of gas.
Yes, sir. Now I remember.
So there is a spiral tube. Yeah.
Yes, sir. It's just a Bourdon gauge, but the bellows change their size when they are exposed to heat.
Yes. Yes.
And then the gauge records pressure as if recording.
Where is it used, sir?
Gas expansion.
Where is it used? Any idea?
No idea.
It is used in outdoors and in harsh environments. And advantage is that it is cheap and robust, and disadvantage is that it has poor accuracy and requires recalibration. So for all of these disadvantages, you can just mention poor accuracy and requires recalibration, because most of them are having this same disadvantage. So just for remembering, I'm just giving you a tip. Okay. Next, anything else, sir? Non-electrical? Bimetallic strip thermometer.
Yes, bimetallic strip. I just know the principle of bimetallic strips. I don't know how it's used in practice.
Basically it's a coil. It has two different metals with different expansion coefficients. So when the temperature increases, this metal expands by different amounts, and that causes a pointer to move on a scale. So that is
used. It's used in variable bypass vaporizers.
Yeah, similar to that. Exactly. But this is this has a pointer which moves according to how the coil tightens or untightens.
Right.
That is all. Yeah. So this also used outdoors, and same disadvantage is the same thing: poor accuracy and requires calibration. Chemical thermometer.
I'm not aware of that.
Yeah, I'm going through these very fast because they are not asked usually in detail, but you should. It is nice if you just know and you can just mention. So basically, these there are strips which contain a chemical mixture, and they melt at different temperatures to produce a different color for a different temperature change. Okay, so this can also be used to measure body temperature. The advantage is it has got very rapid response times, but disadvantage is that it is not accurate. Okay, so electrical, what are the three types that you know?
Electrical, one is the thermocouple.
Yes.
The other is thermistor.
Yes.
I know of only these two.
Thermocouple, thermistor, and resistance thermometer. Resistance thermometer is your platinum wire thermometer.
Okay.
Okay. There are three images that you should know because x-axis and y-axis are different in your thermocouple and resistance thermometers. Yeah, but the graphs look alike. Okay. In your resistance thermometer, the x-axis is your temperature and y-axis is resistance. Whereas in your thermocouple, the temperature is x-axis and y-axis becomes the junctional voltage. Okay. So you may be asked to draw these graphs, so you just have to remember those graphs. Okay. And thermistor, any idea, sir, where these thermistors are used in practice?
Thermistors are semiconductors whose resistance falls as the temperature goes up.
Okay.
it's in contrast to all other metals whose temperatures, whose resistances go up as they are warmed up.
Excellent. Excellent. That's an excellent point.
And the variation in the resistance is exponential.
Yes. Okay. Where is it used, sir, clinically?
It's used in Swan-Ganz catheter used for thermodynamic dilution technique.
Excellent.
And nowadays they have Foley's catheters with a thermistor at the tip.
Yes.
For monitoring temperature.
Yes. Advantages and disadvantages?
Sir, advantages is it's small.
Yes.
Not very expensive.
Yes.
Can be built into devices.
Yes.
The disadvantages
response time is rapid or slow?
Is rapid.
Yes, excellent.
Response time is rapid. The disadvantages are that it needs to be calibrated.
Yes.
And over time it loses accuracy.
Excellent. Excellent. Fantastic. And other types, electrical, non-electrical, anything else for measuring temperature, which is clinically used? Tympanic membrane, what type of thermometer?
Yes, sir, infrared.
Yeah.
Infrared.
Yes. Excellent. Excellent. So any principle?
In fact, I've used it also.
Yeah. Yes, sir. What is the principle behind this?
Principle is, sir, all warm objects, they radiate infrared radiation.
Yes.
And their frequency is based upon the temperature.
Okay.
So there's a device which can be used to look into the ear and focus on the tympanic membrane.
Yes.
Tympanic membrane represents temperature of the brain.
Yeah. Otherwise, and, also the core body temperature.
Core body temperature.
Yes, correct.
And whatever frequency of infrared radiation is received by the measuring device is sensed, and the temperature is displayed accordingly.
All right. Excellent, sir.
It has one problem. If there's wax in the ear, it would give a false reading.
Excellent. Yes. All right. So we completed 1 hour, and thank you, Dr. Narinder, sir. It was a very excellent session. I have absolutely no doubts that you will pass this exam. So you will ace it.
Thank you so much.
Yes, sir.
I got to learn a lot.
Fantastic. Fantastic, sir. And I hope you continue to participate in these vivas. And
I'm enjoying them.
And I just want to tell the others, be absolutely inhesitant to participate in these vivas, because the only difference between you and me is that I have passed the exam and you're about to pass the exam. That is the only difference. There is no big deal about this. It's a very volatile subject, considering all the work that we do every day in our daily routine. We are very busy. We are unable to study. We are unable to revise. So it's perfectly okay if you don't answer, but just volunteer for these mock vivas. This is the best opportunity you have to make mistakes and correct yourself. And once you are in a mock viva, I am sure that you will never forget, even in the exams as well, even if you don't revise. So my suggestion to you, just volunteer as soon as you get to know, so that you can be in the 3 volunteers list, and you can take up these vivas. And in fact, if you volunteer and if you're motivated and if you study it once, it's for your own good that you have already covered and completed one topic, like forever. You may not have to revise it at all. All right. Thank you, everyone. Thank you. So
thank you so much.
Yeah. So we'll meet next time then. All right. Okay. See you, everyone. Thank you.
Thank you very much.
Thank you.
Thank you, sir.